So, I am somebody with bipolar disorder who has been hospitalized about 5 or 6 times for different manic and psychotic episodes. And I thought it would be interesting to analyze some psychiatric interview footage showcasing people with the disorder and what they're going through, and just talk about the symptoms and what they're experiencing and bring to light my own opinion about it. So if that sounds interesting to you, then stick around. So some of the things you want to look out for when you're trying to see what is bipolar and what is not in somebody is that there's a noticeable change from normal behavior. So obviously knowing the person before they got manic and psychotic would have been a better way to be able to gauge the actual change. But it's pretty obvious once you know what you're looking for. So there's flying suddenly from one idea to the next, loud speech, obviously an inflated self-image, sense of self. You could be hypersexual. Often there's substance abuse. There's a noticeable change from normal behavior. You'll be jumpy, wired, upbeat, distractible, make poor decisions. Suspiciousness, withdrawal from family and friends, and delusions are common. Switching topics erratically, difficulty even knowing what's real. Experiencing things others don't, and holding on to beliefs that have no ground in reality that others can't even grasp at all, and following this, not being able to speak clearly. It can seem like outside forces are in control of your feelings and actions. Small events or comments can have huge, grand, overarching meanings that can change seemingly your entire life and mind. You can believe things that others don't. You'll have unusual, intrusive thoughts or beliefs that cannot be set aside, and you'll have increasingly difficult times thinking clearly. And all of these symptoms somewhat are present in the psychiatric interview we're going to be looking over, so I'll try to point them out as they happen and the order that they happen and what leads to another. So let's check that out. The first 15 seconds of this interview are fucking magnificent when you're trying to look at the symptoms of bipolar.
I'm sure glad. You're a savior here. You can put me in perspective and tell these people that I'm not a nut.
Well, of course, anything you tell me will be confidential.
But I don't want it to be confidential. I want you to sell the interview to Playboy, send it in, and give the money to charity.
So we see right off the bat incredibly rapid cycling ideas, going through a lot of stuff, and then we see a very huge delusion after she tells him that it's a private interview and that no one else will see it. He says, I want this interview to be sold to Playboy. So that's a massive delusion coming out in the beginning, which was spawned right after a massive flight of ideas. So he goes through a massive flight of ideas. Oh, sell to Playboy. Boom. That's the delusion we're running with now. But you'll see he doesn't actually hold on to it for very long, which is another sign of how deep into psychotic and mania this man is.
Why would they buy it?
Why not? It's just as good as anything I've ever read in there.
So just as good as anything I would have seen in there. You know, comparing himself to published authors in a very big magazine. Obviously it's Playboy, so it's not a huge, intellectual article, but still comparing himself to the biggest dogs in the game is delusional and exaggerated sense of self, a delusion of grandeur, obviously.
Are you going to say something that will interest them?
I imagine it'll sell. I've got one of the most brilliant minds of the 20th century. They might like it. Just make sure the money's given to charity. Give it to Bangladesh. Make sure the kids get the food, though. Don't give it to some idiot that's going to pocket the money. If Playboy doesn't want it, sell it to Penthouse. If Penthouse doesn't want it, kiss my ass. If they don't do it now, they won't be able to do it later, so it's their opportunity. If he has a sense, he'll buy it. Of course, I wonder about Hefner having an ounce of sense. He plays pinball.
So after an incredible delusion of grandeur, saying he has one of the best minds in the 21st century, now it's going on to unusual talkativeness. We're moving into different stages of just speech and anything related to the topic being able to say, and we'll even see it actually cuts out on him talking about this delusion. So we see after a massive delusion related to a massive sense of self and a massive sense of delusion of grandeur, we see right after that he rambles on and moves away from the topic, almost forgetting about it, and is happy to answer a new question and not bring this back up. So we can see this man is pretty deep into the symptoms of what's going on here.
But I'm sure he's got brains. If he runs a magazine like that, he's no dummy.
I want to know more about the treatment you've received. Is this the first time you've been in the hospital?
This is the 4th time.
How long ago was the first time?
About 6 years ago, September of 1976, and I'm doing well. What a good boy am I.
So a little erratic behavior after he says he's doing well. He claps, you know, he knows he's back in the hospital after he says he's been in several times. So obviously maybe he's not doing as well, and that clap is a nervous clap, and he's actually trying to convince the psychoanalyst that he is doing well, when in reality maybe he isn't doing so well, since, you know, 15 seconds ago he said he wanted the footage of this interview sent to Playboy to feed starving children. So obviously maybe this man isn't doing as well as he wants her to believe, and so that loud clap could probably be the cause of that.
During that time, would you describe your mood as being depressed?
Yeah, it was despair. Utter despair, utter despair.
And what about the second and third times?
Second time it was fear.
So just notice how he slows down when he starts to talk about his previous visits and how he was depressed. So obviously you can tell through his memory he's not always this agitated and not always this excitable. He has been through depression, and he knows that, and he doesn't want to talk about it, and he does, and it brings on a somber mood. But as you can see, since he's in mania, this somber mood is against the actual flow that he wants to bring to the table, so he'll actually have an outrage soon based on just the fact that there's no current manic energy emitting from him. So we'll see him calm down here, and then the next thing he'll do is another delusional, manic, psychotic type thing. So no, in the DSM, to be manic, it must be going on for most of the day for multiple days. So we can see this moment here is a very brief moment of calm, but since he's still in the throes of this mania, which could go either way, he's being treated now. So since he's still in the throes of this mania, it'll come back very soon.
Paranoia. Paranoia and despair. Third time it was, God, my ear's starting to itch. Third time it was so-so. It was a rough trip, a rough experience. They were very tough on me. But it was pretty good because I knew what I was talking about. But I wasn't being given credit for what I knew, for the actual common sense that I had. Everybody was telling me I was crazy, you know, but I knew better. God, is it bright in here. Boy, is it nice. You feel the sun?
Yes, I do. It's nice.
Oh, yeah.
But
Yeah, I'm sorry. My teeth feel like they're so clean. It's unbelievable, really sparkling clean. My gums are just seething with energy and lifeblood. I can feel the roots being energized, just the blood flowing to my gums, to my teeth.
Just quickly, I'd like to point out that this is the immense distractibility that one can go through when experiencing mania or psychosis. It's very difficult to follow what your own mind is giving you, even more difficult to say it out loud, and this guy is going through a lot of very cycling, rapid-fire thoughts, and what he's producing verbally is very hard to follow.
It's good. Yeah, fourth time. This is the best. You can't beat it. I feel extremely secure, very happy, very loved by people around me. People are attentive to me, you know, like you and I are.
Just notice how he's extremely excitable here, but also extremely agitated. There's a lot of anger and a lot of staring and a lot of harsh moods coming from this, and this is because he doesn't want to be here. But with mania, everything comes out in this bubbly, self-fulfilling, fantasized way, so obviously the truth of the nature that he doesn't want to be here and things are not going right is only being shown through the agitation that's flowing through.
God, I've never seen so many beautiful women in all my life as in Bloomington. They say LA's got the beautiful women, and I say, this is much better.
maybe it's the students. So are you a student?
Yeah, I'm a student.
What are you majoring in?
I'm presently in the graduate program in journalism.
Where did you get your BA?
Notre Dame, the Notre Dame. Cheer, cheer for old Notre Dame. Wake up the echoes sounding her name. Send the volley cheer on high. Kick down the thunder from the sky.
Now, if there was one thing from this video that I would like you to take home, it's this. When in mania, the smallest things, such as a simple name, can trigger you into doing the most outlandish and crazy seeming things possible. Simply remembering the name and immediately launching into song is a very, very, very great example of what somebody might do in the throes of a real and psychotic manic episode. And just imagine what it would take, the mindset, for you to be having a casual conversation and to remember a song like that and to immediately stand up and march and sing and not think that that's a problem and to not realize that's not normal. That is basically a bipolar episode summed down.
Whether the odds be great or small.
What about this time in the hospital? Have you been worrying about anything in particular?
Well, I was in tune to the fact that my friend's wife was pregnant. And I had also thought that Olivia was pregnant at the time, Olivia Newton-John, although I realize now that she is not pregnant. But I had assumed this cross-transference, and as a result of that, I had assumed that she was pregnant, and if she was, I didn't want to take the chance, so I just got a call for help intuitively.
Now, this right here is an example of a psychotic delusion, although it's not him presenting the psychotic delusion, this is him repeating what the psychotic delusion was. But yes, that's very realistic. So you think one person's pregnant, then that tumbles into thinking another person's pregnant. I had an episode where I thought two people had died. I thought one person had died and then another person had died, and I had no proof for that. So I actually relate to this delusion a lot. But the important thing to realize is this is the psychotic aspect. Mania, you've been seeing a lot, the energy, the singing, but that psychosis, that delusional thinking that this person is pregnant and this person, it's intuitive, that is where things stop making sense. You know what I mean?
So you wanted to help Olivia Newton-John?
Yes.
What is your relationship with her?
I'd rather not discuss that.
Have you talked with her?
Yes.
How do you communicate?
Intuitively.
And what does she say to you intuitively?
She says, "Go get him, Tiger."
And you also got the impression that you were supposed to help her intuitively?
Yes, exactly.
What effect did that have on your hospitalization?
If you're having trouble following this, don't worry, they both are. The delusional bipolar patient is having trouble following this because I can clearly, he doesn't seem to remember very well what was going on. And the doctor here does seem to remember, but she doesn't have the insight into understanding why he thought it. So they're both at kind of a crossroads where this delusion doesn't make sense to either of them, but he still believes it because it led him, and, well, okay, fine, I won't try to say why he believes it, but he still believes it because they're still entertaining the truth that he communicates with this famous celebrity intuitively. But this is like another example of where she's delving into the very delusional aspects that he's happy to avoid and almost probably is embarrassed about. But yeah, she wants to go deeper into it.
Well, some dummy was under the impression that I thought I myself was pregnant, and apparently they reported that I thought I was pregnant, and so they thought I was ill, so they felt it was necessary to hospitalize me. I believe that the first stage in the process of a child being born is the first half of conception, which is termed the Immaculate Conception, which is the first cause and first positing of the possibility of a child being born, which is conceptualized first of all in thought before it actually takes place, if you do it right. Of course, if you just want to stick your prick in some chick and have a kid, then, you know, if that's your limited mentality, then that's the way it goes, and have it, but I don't work like that.
By this point in the video, it should be pretty obvious to you that this is not the actings of a normal person in a normal mental state. If you've been following properly along, you can clearly tell that the last clip I showed was full of delusion, full of psychosis, and very manic. And all of that leads to the fact that this person is sick. Now, I will mention this is a acted interview. This is just for educational purposes, but it's very, very well done. And if you can see the problem in the last clip and how he was acting strange compared to a normal person, I think you've succeeded in the goal in this video.
They kept telling me to take it, and I knew it wasn't going to do me any good, so I quit taking it about 6 months ago, and I told them, if they're going to give me Lidome, I'll lie to them too. So I quit taking it. Now I'm being restructured on a new medication. I'm taking Haldol and lithium.
Okay.
just focus on how fidgety his body is. When the energy of mania isn't able to come out through his words or through his thoughts while he's listening, it has to come out through his body. So we see this constant shuffle, this very manic energy coming out of all of his limbs and his torso and his head.
We were talking about your mood and how you feel you're in the groove. Would you describe that as feeling euphoric?
No, I wouldn't say it's euphoric.
How would you describe it?
It's like feeling integrated, having something to do and getting it done, being tight on time.
Have you been more energetic than usual?
Oh, yes, it certainly was.
How would you describe that?
It's a need to perform. To put on a show, you know. I was listening to the Chambers Brothers, Love, Peace, and Happiness, and God, it was coming straight on time. Really, the timing was perfect between their music and my thinking, my emotions. Every time a muscle would twitch, they'd hit a cymbal or something. It was amazing.
So you should be able to tell the difference between mania and delusion, hypomania, different things like that. This should have been a pretty educational video if you didn't know any better. But I will say, the good thing about bipolar, there's two good things. One, it's not all of the time. You have an episode and then you go back to normal. And two, there's immense memory loss included in psychotic and manic behavior, so you hardly even remember the embarrassing things you did. We'll be making more of these soon. Thanks for watching.